what is endometriosis, and I want to know in detail about the age group of the patient who commonly come with endometriosis, and also the hormones which are responsible for the endometriosis.
Endometriosis is a condition that is very unique to women of the reproductive age group. By reproductive age group, I mean somewhere between 15 to maybe 40 or 42 years up to 45 years. Before understanding endometriosis, we must know a little bit about the uterus. The uterus has got an inner lining that is called the endometrium. So usually every cycle it is this endometrium that becomes thicker, and towards the end of the cycle this endometrium gets shed away. The bleeding that happens is because of the endometrial tissue that is coming out of the uterus because pregnancy has not occurred. This lining of the uterus, which is also known as the endometrium, is therefore responsive to the various hormones that are secreted in the body. The FSH and also the LH secreted in the brain will act on the ovary and result in the formation of eggs or follicles, which are actually water-filled sacs containing the eggs. These follicles will start producing estrogen, and after they rupture and when the egg is released, the progesterone is produced. So this is the process in the normal menstrual cycle. The effect of estrogen and also progesterone on the endometrium is responsible for the growth of the endometrium, thickening of the endometrium, and finally shedding of the endometrium. Now imagine if this endometrium, which is lining the uterus, is present in other places inside our body. It could be on top of the uterus, that is outside the uterus, it could be on the tubes, it could be on the ovaries, or it could be just inside the abdomen. Such a condition is known as endometriosis. In other words, the right tissue in the wrong place. So it is the endometrial tissue, that is the tissue that normally lines the uterus, is present in the abnormal sites. So what happens? Because of the effect of estrogen and also progesterone, these hormones cannot differentiate whether this endometrial tissue is inside the uterus or outside the uterus. So they have the same effect on the tissue outside the uterus, resulting in thickening of the tissue and finally bleeding from the tissue. So this bleeding that is outside the uterus has nowhere to go. So it gets accumulated in the same place and it elicits various reactions like the inflammatory reactions, and because of inflammation there is something called fibrosis. There is a puckering of all the tissues, and this results in various signs and symptoms associated with endometriosis. Endometriosis can also occur in many places. A deeply seated endometriotic lesion can be inside the intestine, that is the wall of the intestine. It can be over the ureters, that is the tubes that come from the kidney onto the urinary bladder. So these are, and also it can be in various places like in the chest. Okay, and people have reported endometriosis even in the brain. And the hallmark of all this is during menstrual cycle, these tissues or these areas become more painful and symptomatic, and after the periods are gone, the symptoms will subside. So this in brief is about what is endometriosis.